Viewers, you are welcome to yet another edition of the program, Meet Our Guest. Today, the program invites Dr. Zainab Muhammad Idris Kwaru from the Barau Diko Hospital. And she is going to speak to you, to know about her, to know why she takes to the medical profession, and how she was able to climb the position of the chair of Women Medical Association of Nigeria. Haja, you're welcome to the program.
Thank you, sir.
Yes. Can we start by introducing yourself, please?
Yes, my name is Dr. Zainab Muhammad Idris Kwaru. I am a lecturer, a senior lecturer with the Kaduna State University, specifically with the Department of Community Medicine, College of Medicine, Kaduna State University, and also with the Barau Diko Teaching Hospital here in Kaduna State.
I see.
I happen to be the national president of the Medical Women's Association of Nigeria, the first time northerner to assume that seat in almost 50 years of the existence of the association.
Wow.
And it's really a pleasure and my honor to have assumed this position based on the confidence reposed in me by my sisters, the members of the association, and I was elected in 2023 to serve in this position.
Excellent.
Although I started as the national president-elect, we normally spend 2 years, after which we become substantive national presidents. So last year I was sworn in, the investiture took place, and here I am today as the national president.
Excellent. Congratulations, Doctor.
Thank you, sir.
Okay, now, Doctor, can you give us your brief biography?
No. Well, I was born in the ancient city of Kano.
I see.
By my wonderful parents of blessed memory. Yes. I'm the last of 4, although we were 6 of us, but 2 have been lost, and then we remain 4 of us that are still alive. Yes. I started my primary school in Bayero University, Staff Primary School, after which I now proceeded to St. Louis Senior Secondary School in Kano. It's a mission school, an all-girls school, where I also spent 6 years. We were the first set to do the 6334 at that time. I see. We were the guinea pigs that were experimented, but we also excelled. We passed with flying colors, after which I proceeded to Bayero University, Kano, to do my pre-degree. After the pre-degree, we did our pre-clinicals, because I went into the medical field. From there, because the teaching hospital hadn't been ready, we were taken to Ilorin. Again, we were the last set from BUK to be taken to University of Ilorin Teaching Hospital, where we completed our medical education. So we graduated with Bachelor of Medicine, Bachelor of Surgery, the MBBS degree. Of course, after that, I did my NYSC, my youth corps service, fortunately in Kaduna State. I see. Again in Barau Diko, but at that time, the children's wing, which was called Ibrahim Abacha Children's Hospital. We spent a year of the National Youth Service. We also did a lot to make sure that we're able to serve the needs of children that were brought into that hospital. After that, I had some stints in NMPC. I was there as one of the support staff. It wasn't, I think people call it casual staff. We spent some years, I think 2 years before I went to National Board for Technical Education as a medical officer. There, I think I spent about 3 years before I went into development work. I started with Action Aid International, thereafter with Family Health International and APT Associates, and of course various other programs that were funded by the British government. That was the Department for International, the UK Department for International Development, which is currently known as FCDO. We also did some programs around Partnership for Transforming Health Systems. We also did some programs that we are able to bring up the systems that we currently have that strengthen our primary healthcare, the agencies that are in charge of addressing HIV issues, and then ultimately health system strengthening. And a host of so many things. I went back to school, did my residency, became a consultant as a fellow of the West African College of Physicians. I've also had interactions or studies that gave me other fellowship. And I went as far as going international to other countries where I earned additional qualifications to become where I am today. And today I'm the National President of Medical Women.
Wow. What an impressive biography, Doctor.
Thank you.
Congratulations.
Thank you, sir.
Are you married?
Oh, sure. I was married since in medical school.
Yeah.
I married in my last year of medical school and even had my first child, as a medical student.
I see.
And of course, it didn't deter me. I was able to complete my studies with flying colors.
I see. Now tell us, what interests you to take the medical profession?
I think there's a lot. As a young child, I've always been fascinated by the environment of the hospital setting. Whenever I go into a hospital with my parents or with my siblings, I see the way, the conduct, the comportment of the medical workers. Especially at that time, of course, what we see and know are the nurses with their white, shiny, uniform, the way they dress very smartly. I mean, it kind of attracts you. And then again, the experiences of having people falling ill. You would want a situation where you want to give back, you want to take care, that nurturing, sentiment, the sense of trying to give something that will make people recover, were some of the things that made me interested in going into the medical field.
I see. In northern Nigeria, women are not encouraged to go to school, talk less of pursuing medical profession. How did you make it?
Well, I had parents that believed in school, especially my father.
Yeah.
And I also have found myself in a situation where my elders were really doing very well in school. So I was fascinated. And like I said, the support of our parents really helped. Even though we were in an environment where a lot of the girls at that time were married off. Some, if they are lucky to even finish their primary school.
I see.
And for those that are not able to go beyond secondary school, people get married. We have seen all of that around us. But my parents, especially my dad, stood his ground. I think he had that foresight and he believed in the education of the girl child.
Is there any challenge you face?
Well, the challenge that we faced was when we lost him. At the time we lost him, I had just, in fact, I was going into sit for my SSCE, my WAEC exam. The day I was supposed to start my WAEC exam, I lost my dad.
Oh, sorry. Sorry, in peace.
I mean, So I had a principal that was very caring. She came personally, took me to the exam room, and that was how I was able to sit for that exam. And alhamdulillah, I was able to make it with very flying colors. I was so proud that my dad stood by me all through. Although he didn't live to see the
end of it.
The end of it all.
Yeah.
Yes.
All right. Now, you are on the position of the National President of Medical Women Association of Nigeria. What does this position entails in northern Nigeria?
Well, it's a position that covers the whole of Nigeria. Let me put it that way.
Okay.
It's a position that one is responsible for all medical personnel, all medical women, and medical doctors and dentists in practice. And it's a huge responsibility where we have to coordinate the mandate. Our mandate and focus is on women and children. Any issue that affects their health. And when we say health, we're looking at it from the physical, social, and mental perspective. We're not just looking at what we're doing within the hospital confines. We look at those aspects and see how much we can contribute. And that's why we have our slogan as healing with the love of a mother.
I see.
we know that as women, we have what it takes to improve those nurturing care. And we also are in a very good position to really project the issues that we have as women, both as our members as well as the teeming population of people that we serve in that space. Again, we have young girls. We do a lot to see that we're able to position them to also aspire to become people like us. And that's why we embark on mentorship, and then we ensure that we encourage and we sensitize, and we go into schools to attract them to follow similar path as we have done.
I see. Now, can you beat your chest to say that as a result of you being in this profession, so many women folk, especially from the north, and in particular, have embraced the profession?
Oh, sure. I'm very proud to say that maybe before now, when you go into medical schools or any health training institution, you see very few women. Of course, aside what you see in the nursing profession, where we have more women than men doing nursing and what have you. But then when you now go into our medical schools and you compare with what we have in previous times, many more and more women are being enrolled into medical profession as medical doctors. So we're having more and more of these numbers. So we're proud to say that that has also rubbed off. Part of the work that we're doing is increasing the population of women that go into medical practice.
I see.
That is one. Another thing that we're proud to say is happening is that we don't just become medical doctors. We're also spreading ourselves to make sure that in most subspecialties, we have our women that are practicing and are also becoming specialists in different areas. You have pediatricians, you have obstetricians and gynecologists. We have those that go into dermatology. We have those that go into psychiatry, ophthalmology. In fact, even the lab sciences, the lab medicine, where we have pathologists, we have hematologists and chemical pathology, different fields that you can think of, including surgeons, which used to be an arena where men dominate. We have more and more of our women doctors going into such fields. And we have dentists as well. There's so many of them that are dentists and psychiatrists that we have in the profession.
Will you be able to tell us how many medical doctors, women medical doctors we have in northern Nigeria currently?
Well, I don't have the figures readily at my fingertips, but I can tell you that we are in thousands.
I see.
In Kaduna alone, we're almost more than 300 women that are practicing in Kaduna State.
Excellent. Okay. Now, there is one problem that is existing in some of our health facilities, especially looking at the relationship between the health workers and patients. Patients are complaining of being molested, being treated inhumanly. Is your association aware of this?
Well, we do our best to make sure that issues of this nature are addressed. We sensitize our members to exhibit high sense of professionalism and decorum, and also be very empathetic when they engage with any client that comes to them. The general perception of people when they go into facility, anybody working in the health facility is a medical doctor.
Yes.
Until proven otherwise.
Exactly.
So some of these incidents are not really our members, maybe some other allied personnel working within the hospital confines or in those spaces, and they end up saying they are medical doctors. So we have had instances like that. We've also had instances where some of our medical personnel actually, we can't rule out bad eggs in any profession.
Exactly.
So we have our own fair share, but a lot of the times we make sure that we go by the rules. Anyone found wanting, of course, we have the Medical and Dental Council of Nigeria, which has the ultimate responsibility of investigating these things and ensuring that they put it in check. But even us, as Medical Women Association of Nigeria, we try as much as possible to reach out to our members. We don't even want such things to happen. We do a lot of sensitization. We do seminars. we sensitize our people, we bring some of these topics on board so that people are aware that the attitude of the healthcare provider is very sacrosanct.
I see.
It's very important that we carry our clients along and we obey or abide by those duties and responsibilities and obligations that we have, that is specified in the doctor-patient charter that we have.
Okay, doctor, we'll allow you to rest a little bit. We go on short break. Viewers, here we go on break, and we will continue when we come back. Viewers, you're welcome back to the short break, and the program continues. Haja, yes, the medical profession in northern Nigeria, in generally, even though you are for the whole country, is something, a big challenge. What efforts is your association making to ensure that medical doctors are enrolled in our schools, not only the female folks, but generally medical doctors, so that they attend to the teeming health issues in northern Nigeria?
Yes. We continue to advocate to our government, both at the state and the federal level,
I see,
to open up space and ensure that we enroll more of our children, the upcoming prospective medical doctors, or rather students that will be enrolled to study medicine. And we contribute a lot to that to ensure that this happens. And then we also have the Medical and Dental Council of Nigeria, which regulates medical practice. They came up with a committee and plans to see how we can expand, open up more space so that we have more students admitted to study medicine. So these are things that are already on ground, which we contribute to. And of course, our policy is also very clear. A lot of the states that before now have placed embargo on employment are beginning to lift those things. And then they are also setting up medical schools, not just what we have at the federal level, but we have states like Kaduna, for instance, that have established their medical school. And it's helping a lot to bring in more and more of the students to study medicine.
I see. Yes. One other challenge in enrolling students, especially from the north, is the issue of cut-off marks, which is strictly adhering by the examination councils, the JAM and what have you. Is your association worried about that?
Oh, sure. That's what I meant.
What are you doing?
That's what I meant by, there's what we call student lecturer ratio. There are provisions, standards have to be kept. And if you don't meet those standards, it can detract from the quality of the education or the training that is provided to them. So that's why it's very important to make sure that we have enough of the teaching faculty, where we have enough of the lecturers that can actually fit in those ratios, where we expect a certain number of students to be attended to by the lecturers or the tutors.
I see.
So that has to be abided by. And then you also have to look at the equipment that is needed for such training. If you don't have enough of those equipment, there's only a certain number that can be taken by any medical school. So all of these things are being considered before that number. That's why the cutoff mark is there.
Okay.
But like I said, with the support of the Medical and Dental Council of Nigeria, our ministries of education and health have put their heads together to see how those spaces can be expanded. And that's why you see some of our students going outside of the clients of this country to enroll in other medical schools outside of the country.
I see.
Because the need is there, but then the spaces are limited. But as an association, we continue to converse, we continue to advocate that we have more of these spaces opened up so that the equipment, the workforce that is required for our training schools is adequately provided. So we're speaking to government as an association, and we're also putting forth our requests to have some of these things done. In our own little way, we're also doing our best to make sure that when admissions like this come up, our women are considered, especially the girl child, because we need more women in this profession to be able to take care of the needs that exist out there.
Okay, financial difficulty on the parts of parents is one other area.
Sure.
Is your association looking into that as well?
Well, one thing we speak to, or that we also advocate for, is to have an enabling environment where parents have the means to train their children. We also have come up with a measure where we do some endowment. We have an endowment and a scholarship committee that is saddled with responsibility to look out for indigent students. Perhaps they are not able to afford some of these things. And we've set some little amount of money, and we're asking philanthropists to come and invest in that so that we can do more for those that are unable. They have the potential, they have the capability, they have they have scored what is required to be admitted into medical school, but then the challenge of funding will prevent them from actually enrolling. So we look at for such students in the little way that we can to see how we can support them to pay some of their fee and then to do their course.
I see.
Yes.
Let's look at your achievements. Can you beat your chest to say that you have achieved something since you assumed this position?
Let me say that we're on course. One of the things we have planned to do is to make sure that we increase our partnership. And I must say that has happened. Secondly, we want to have a physical presence. In most of these things that you see us doing, we're operating from our respective workplaces. As an association, even at the national level, we do not have a physical space. We don't have an office to call to say this is where we operate from.
Why?
Well, we didn't have the means. We are not very rich, so we need both government and the private organizations, philanthropies, everybody that can come to our aid. And I'm happy to say that we're beginning to have people coming to ask us what our needs are. And we've made those presentations, and we're optimistic that very soon we'll have an office space to call our own, so that we have a physical space where we operate from. And we hope that will happen not just in Abuja, the seat of government, but even in most of the states that we have across the country.
I see.
Yes.
Now, what other challenges do you have in terms of running this organization?
I would say the biggest challenge that we have is finances. We operate based on the membership dues that we collect, and then some of the goodwill that we enjoy from different organizations and bodies, including government. So we would want a situation where more and more outfits, more stakeholders come in to provide us those support. Because a lot of the programs that we really want to embark on would require financing. And if we don't have those finances, there's only so much that we can do as an association.
I see.
Yes.
Now, association of this nature is very, very significant, very important in community, especially in the medical community. What recommendations do you have for this association to continue to exist and to play a greater role that will serve the interests of the general public?
Yes. One of the key things that we continue to advocate for is for people to come in and partner with us. The more we partner with organizations, programs and what have you, it will give us more space to really do what we are known best for.
I see.
We are caregivers.
I see.
And we do a lot, right from sensitizing people on knowing what it means to take care of their health and how they need to be patronizing our health facilities and what they stand to benefit if they give us that attention and the space to give back to the society. So we can do more once we partner, and then we are also provided the enabling environment, including coming in to invest in what we're doing. I think it will go a long way in helping us to give back to the society.
I see.
And we need the communities to also be receptive, to give us all the support, all the encouragement, so that we have more and more of our girl child go into medical practice.
I see. Any appeal
Yes.
to the community, to women folk, to doctors, to government?
Yes, to government, we continue to advocate that we have the enabling environment in terms of policy, in terms of getting the equipment, and also getting more and more doctors employed into the system. And then, of course, remuneration is also very key. We want our members to be well paid so that they have what it takes to continue to be motivated to put in their best. And of course, with this brain drain that we're having, we want our members to stay back so that we put our heads together to continue to improve on the healthcare delivery in our country and our states. And then to the communities, like I've said, we need communities to be hands-on when it comes to healthcare and ensuring that we have what it takes. So, and then we also want community members to continue to patronize our facilities, particularly primary healthcare centers, so that they also get the best out of this system. And of course, being there will continue to lead to improvements. They will help monitor. They will also help to ensure that our systems and our services are running. And then to our members, we want more and more of our members to continue to do what they know best, coming together, contributing, and then even providing time to actually carry out those programs and activities that we have planned and lined up.
I see.
Yes.
Doctor, we thank you very much for finding time to be in our studio and to answer some of the questions we have.
Thank you, sir.
And we hope you will come again when we invite you next time.
It's my pleasure.
Thank you so much.
Thank you, sir.
Viewers, it is here we come to the end of the program. Meet our guests, or guest of the week. And from me, Ibrahim Dosara, and from Dr. Zainab, I wish to say goodbye.